Hi, my name is Tiffany Stewart. I'm a family nurse practitioner student at Clemson University, and today I'm presenting a patient for case study. The patient is a 26-year-old Caucasian female who presents to the office with chief complaint of headache, facial pain, and nasal congestion with purulent nasal drainage. She states these symptoms have been going on for the past 10 days. She tried over-the-counter NyQuil for the past 3 days, and she had no relief from that. She also voices associated symptom of fever, sore throat, and decreased appetite. Her past medical history is unremarkable. She's had no surgeries other than having her wisdom teeth removed. Her last menstrual period was 1 week ago, and she has not been sexually active since. She denies any tobacco or illicit drug use, and she states social alcohol use, stating she has a glass of wine every couple of weeks or so. The current medications, the only thing she's on is a daily women's multivitamin. She states that she felt febrile at home, but she does not have a thermometer and she was unable to take her temperature. She denies any lymphadenopathy. She denies any recent trauma to the face or nose, denies ear pain, teeth pain, nausea, vomiting, dizziness, shortness of breath. Also denies any wheezing, chest pain or chest tightness, and any recent changes in bowel or bladder habits. She does admit to having the facial pain that she said is generalized over her entire face, as well as fever, sore throat, and the decreased appetite. Her physical exam today reveals that she is alert and oriented ×3. An oral temperature of 100.4 was obtained in the office, and she stated she had not had any antipyretics since the previous evening. Her blood pressure was 117/82. Her temperature was, as previously stated, 100.4. Her respirations were 18 and her pulse was 72. Face is symmetrical without signs of periorbital edema or cellulitis. Sinus tenderness is noted over the frontal and the maxillary sinus areas, and there is inability to transilluminate these sinus areas. She has yellow nasal drainage in both nasal cavities, but both cavities are patent. The nasal turbinates are erythematous. There's, however, no signs or symptoms of nasal hematoma. The eyes are clear, there is no swelling, no drainage, no discharge, but it is noted that she has allergic shiners under both of her eyes. The ears, both TMs, are intact bilaterally, pearl in color, and there is positive light reflex. No signs of effusion in either ear. The posterior pharynx is mildly erythematous, but there is no exudate noted. No tonsil or uvula enlargement. The teeth and gums are clear. There is no lymphadenopathy. Her lungs are clear and equal bilaterally. Her heart rate is regular rate and rhythm, S1, S2. Her abdomen is soft, non-tender, no mass is felt, and she has positive bowel sounds in all 4 quadrants. The differential diagnoses today for this patient would include viral URI, viral rhinosinusitis, dental abscess, trigeminal neuralgia, optic neuritis, migraine, and malignancy. There are no diagnostics that are needed at this time as the clinical findings are significant. The treatment plan for this patient today would be tailored toward the diagnosis of sinusitis. And treatment would include, due to the length of her symptoms and the presence of unilateral facial pain and the purulent nasal drainage, I would prescribe an antibiotic for this patient. I would prescribe amoxicillin, 500 milligrams, TID ×10 days, as long as there's no penicillin allergy. In addition to antibiotic therapy, I would prescribe an oral decongestant expectorant combo, and the one that I would recommend for her is the over-the-counter Mucinex D. She can have 2 tablets every 12 hours, PRN symptoms, with a max of 4 tablets in a 24-hour period. She can also take Tylenol for pain and fever. In addition to the previously stated medications, I would increase fluids, have her to increase her rest, possibly use a humidifier, and good hand hygiene to prevent the spread of any germs. Teaching was provided today for this patient on the disease process and on her medications, including side effects and any symptoms to notify the office staff for. She was also encouraged to follow up if her symptoms worsened or she had no improvement on the antibiotic therapy within 1 week's time. Thank you.